Hi, my name is Jessica. This is Assessment Task 4, Part B for Healthcare Environments. This presentation is an educational tool to teach new staff members at the hospital about the importance of hand hygiene. We look at the risks associated with poor hand hygiene and how it can affect the patient. I will also be discussing on when and how to wash your hands. In hospitals, diseases are easily spread. Hand washing is the most important hygiene measure in preventing the spread of infection. If hands are not clean, simple tasks such as placing a finger in the mouth, rubbing the nose or eye may transmit enough germs in the body to cause infection. The nurse's duty of care requires them to make sure that their facilities are free from hazards that can put their health and safety at risk. A hazard refers to something that has the potential to harm you, whereas a risk is the likelihood of causing harm. There are 5 types of hazards in hospitals, and these include physical hazards, biological hazards, chemical hazards, ergonomic hazards, and psychological hazards. Any infectious agent transmitted by the contact or droplet can potentially be transmitted by touch. There are 5 moments when hand washing should occur. According to Hand Hygiene Australia 2017, the moments include before touching a patient, before procedure, after procedure or body fluid exposure risk, after touching a patient, and after touching a patient's surroundings. The moments were developed by World Health Organization in 2009. These moments help to protect patients against acquiring infectious agents from the hands of the healthcare worker, help to protect patients from infectious agents entering their bodies during procedures, and protect healthcare workers and their healthcare surroundings from acquiring patients' infectious agents. This is an instruction of how to properly wash your hands. First, remove your jewelry. Next, use pump liquid soap. An antiseptic solution is to be required for staff before performing aesthetic procedure. You should avoid touching the sink. You then wet your hands with warm water, lather hands with soap and vigorously rub together, making sure all surfaces of the hands are covered for about 20 seconds. Rinse thoroughly under a moderate steam of water, dry thoroughly, and turn the tap off with a paper towel to avoid the bacteria living on the surface of the sink. There is a huge issue in the hospitals in Australia, and this is the spreading of diseases. This can be avoided by having your correct immunizations. You should avoid touching sharps and disposing materials. It is necessary to wear personal protective equipment. This includes gloves, plastic aprons, protective eyewear, and masks. According to Hand Hygiene Australia 2018, the average compliance rate for hand washing was only 84.8%. Also, the Clean Your Hands campaign has been introduced in England and has increased the hand hygiene compliance rate from 32% to 63%. And the use of alcohol hand rub increased by 184% according to Health Infection Society 2006. This means that by increasing the advertising of hand washing, it will increase the rate of it being done properly. And here are my references. Thank you.